In this video, we are talking about centers of excellence. This has been a really requested video from our audience. Thank you so much for all of you who have left your questions and comments in our comment section. And we're going to talk about what is a center of excellence? How would you define it? And we want you to know some background information. You know, some centers have a really strong marketing pool to a certain type of treatment, and some centers do clinical trials. It doesn't mean that these are bad things. It means they're things to hold in your mind as you are making your decision. We want to make sure that you're making a treatment decision based off of your particular type of prostate cancer, and also seeing if you can eliminate as many side effects as possible through that process. So today, as we talk about centers of excellence, Dr. Mark Scholes, who's a 30-year medical oncologist focusing solely on prostate cancer, is going to answer your questions. So today we're talking about centers of excellence. You know, we've mentioned this term in other videos, and I think multiple patients have asked, how do you define a center of excellence? And I think there's also some nuances and some caveats that we should talk about today, just to make sure that patients are fully informed as they go on their search to find the best place. But, you know, when you talk about a center of excellence, what comes first to your mind?
Probably the first thing is specialization. The area of the body where the prostate is located is kind of like Grand Central Station, with the bladder and the rectum and a bunch of nerves and the urethra all running through this area. The treatment outcomes, cure rates to a lesser degree, but quality of life after treatment is really influenced by the quality of the treatment. And it's not like a gallbladder operation or an appendectomy, or maybe a hernia operation takes, there's a range of skills, but the skill of the center, and particularly the doctor who's doing the treatment, is a big part of how well people turn out.
I appreciate you mentioning that, because I was talking to a helpline patient. They were saying they were going to go have hormone therapy, and they were trying to find a center of excellence. And it was interesting because it wasn't procedural. It was something that's choosing a medication and maybe finding the right doctor. So are there certain situations where a center of excellence is more crucial than others?
Giving someone a shot and the treatment results are almost guaranteed. Testosterone will fall down, cancer will regress. But there is a component of specialization in that area as well, because the side effects of hormone treatment, the list is incredibly long, and there are ways to counteract those side effects. And some doctors are more knowledgeable about how to counteract the side effects, others are less knowledgeable. People can educate themselves online and talk to their doctors about whether these are appropriate ways to counteract side effects. The issue with medicines is that mistakes are usually reversible. So if someone has a side effect from hormone therapy and isn't getting appropriate counteractive measures, well, you can go online and learn about it, implement the counteractive measures, and it's unlikely that the downfall will be durable. But with surgery or radiation, when you're treating the prostate, it's quite possible that the side effects can be lifelong.
So what about in situations of diagnostics? You know, we have like blood tests for PSA, and then you have genetic testing and all those. Are those more generalized where you wouldn't need a center of excellence, or there also are specialties when it comes to those things?
Well, in the field of prostate cancer, we think of two scans as being very pivotal: PSMA PET scans and multiparametric MRIs. Turns out for the former, the PET scans, they're fairly straightforward. PET scans have been around for all cancers for many, many years, even decades. And so there's a repository of training and equipment out there in the general world that the new PSMA PET scans can take advantage of that. On the other hand, prostate MRIs, although MRIs have been around for a long time, prostate MRIs have been around for around 10 years. And they were not implemented rapidly. They're gaining more momentum every year because they are very effective when done at a center of excellence. If they're not read by highly trained doctors, it is possible that the information that we're getting through an MRI report could be very inaccurate, which a lot of problems associated with that. We need accurate information to be able to design optimal treatments.
Before we get to our next question, I just wanted to remind you that we are having an in-person prostate cancer patients and caregivers conference next September, and we would love to see you there. It's a great way to get your questions answered by prostate cancer experts all in one weekend. The next thing is, if you could please subscribe to our YouTube channel, that would really help us out. We want to get our videos out to thousands of other prostate cancer patients who need help, and your subscription will really help us do that. And also, if you would like to support us financially, you can do so at pcri.org/donate. Now back to my conversation with Dr. Scholes. So what if you're in that situation? What if you did get an MRI that wasn't the best, and now the person reading it, was looking at it and maybe they missed something? How much does that change the outcome, and what are the variances between that?
Well, one of the first problems is that people don't realize that it's not the best. The report may look fine, and therefore people are designing treatment based on wrong information. I'd say one of the common situations we come up now that MRIs are being used more is when PSA is elevated, MRI is obtained, and the reader says there's an abnormal shadow that needs a biopsy. We've learned that in receiving MRIs from facilities that we're unfamiliar with, if we have them overread at a center of excellence, that maybe half the time these shadows really aren't there. The problem with inexperienced readers is that they're afraid of missing anything, and they don't want to be sued for a cancer that later shows up that didn't get biopsied. And so they tend to overread or be overly cautious. And as a result, people can end up with biopsies they don't need.
So we talk about double checking PSA, we talk about double checking in biopsy reports, but even double checking imaging is really important.
Yeah, in particular, if the doctor who's responsible for the clinician, the person who's trying to decide what to do for the cancer, is seeing a pattern that doesn't fit. So you have someone with very low PSA who has a PET scan showing metastasis. That's the type of situation where you want to ask, is it possible that the scan was misread or is incorrect in some way?
So when it comes to these centers, there are a couple of really great things I think about, and there's a couple negative things. The great thing is that you can see that they've done a lot of that particular procedure, but a negative thing would be sometimes they market very strongly to the patients based off of the type of treatments that they have. One of the things that we are trying to promote is that patients are choosing the best treatment for them, not necessarily what the best treatment the center is doing. And so can you speak to that a little bit and making sure that patients customize care?
Yeah, it's a very challenging situation. People often are new to this world. They're sort of an emotionally tumultuous situation. They're asked to make big, important decisions with irreversible consequences. And please recognize that the doctors that you're talking to are very practiced in giving their spiel, so to speak. And we expect that. I mean, if they're not believers in what they do, their particular specialty, then who is? But I think sometimes people can be bowled over by the smoothness of the presentation and forget that they need to do their own research. They need to have a sort of a checklist of what their priorities are and really dig down into what type of permanent side effects are they at risk for. I think sometimes that's just glossed over. Modern prostate cancer, for the most part, if it's diagnosed with PSA screening, is going to be curable. So it's not a fight to get cured anymore. It's really a fight to get cured, which is going to happen in most everybody, and emerge without permanent side effects such as impotence, incontinence, and rectal damage.
So we also talk about making sure that you have multiple opinions. You're getting a second opinion, a third opinion, a fourth opinion. I was talking to a patient the other day, and he was saying, well, all the opinions are leading to the same place. And I said, okay, well, that's interesting. I'm glad that's conclusive. And he goes, well, they're all from the same university. And I went, okay, well, that's interesting. So should patients be getting, if they're going to go to like a large university and they're going to get multiple opinions from a large center where they have all these different types of doctors, should you diversify and get different opinions from different centers of excellence and different facilities versus everybody being in the same boat?
Absolutely. I mean, these doctors have to work together. You're going to come and go and you'll move on with your life, but they have congenial relationships. And there are unspoken rules behind the scenes about what kind of patients go where. And these doctors do have to work within the confines of that. And these are smart people. They know how to get along with each other. So I think it's wise that if you want to get a second opinion, go to independent facilities. One thing I've found over the years is that radiation therapists don't like to say anything negative about surgery because they are getting their referrals from surgeons. This isn't the case when you go to a radiation center that is freestanding. Proton centers, radioactive seed centers, and sometimes private radiation therapists, as long as the referral didn't come from a surgeon. If a surgeon is referring you to a radiation therapist, he probably has a pre-existing relationship with that radiation therapist, and the radiation therapist is not going to want to offend that referring surgeon because he wants to get more referrals in the future. And I'm not saying they've ever talked about this is just a reality because the surgeon can send his patients to another radiation therapist very easily. So there's a congeniality between the doctors, and that I think can work against the best interests of the patient sometimes.
So the other concern that I have is that sometimes these centers of excellence tend to be large universities and they're very academic, and then a lot of times patients can get pushed to clinical trials, and then which can be a good thing if it works out for them and it works for their case. However, we even see it in biopsies where patients will get want a targeted biopsy, and instead they'll be getting a random needle biopsy alongside that. So what advice do you have to patients who are trying to navigate that process?
Know what's going on. This is one of the luxuries that prostate cancer patients have. With other cancers, you kind of have to rush into treatment. You don't want the cancer to spread. Prostate cancers, even the higher grade ones, are indolent compared to other cancers, and it gives you time to be a student and understand what your goals are and what these pressures are behind the scene. If people can start to shift away from how can I get cured to how can I get cured without collateral damage? Sometimes people, I think that's too much to hope for. My cake and eat it too mentality. In the prostate world, technology has advanced so much that if you get cutting edge treatment, the majority of men are going to come through with a relatively normal quality of life after treatment.
Patients oftentimes face this situation. They're already overwhelmed by so much information happening to them, but then who do you trust? What's the best information? And I think it's really important that patients understand their particular case of prostate cancer. The more they understand that, it gets confirmed. And I think Dr. Moyad says the more pictures you have to the puzzle piece, you start to get a clearer picture of where you should go and what to do. But then you have trust factors. So not only do they have to deal with the marketing of these, huge centers, then they have, hey, my best friend had this particular type of treatment and it works and he says he's fine. Well, there's a couple of things. Number one, fine's a very general term. A lot of times when you ask more and more questions, sometimes they're not telling you every single little detail that they have to deal with of getting up 20 times a night, or they're no longer able to have normal sex with their partner. So there's a lot of key factors, but then you also have these friends and these trusting relationships. Then you have support groups you can go into, which are great. Support groups are fantastic. We will support groups till the end of time. But you get a lot of really opinionated people there. Sometimes the support group leader said, I had CyberKnife. Everybody needs to get CyberKnife. So you have to watch out for those situations as influencers. And then you have situations where you have these doctors who are experts in their field, but a lot of times maybe they have they bought a really expensive machine, they need to get it paid for, and the marketing's really heavy. So in situations like this where you have your friends who you're trying to, trust and build relationships with, and then they said this is really great and they want to see you be successful, then you have the support group leaders, then you have advocacy groups, then you have, these large facilities, and then you get second opinions, and sometimes they're conflicting. What do you do?
To add on top of that, if any diligent researcher should be looking at online reviews, which I think are generally pretty helpful. As you sort through all that, I think that patients need to score the credibility of the source. The thing I like about the credibility of support groups is that they don't have a conflict of interest. The thing I like about the credibility of a research center or an academic center is that they've published scientific articles on this topic, and they've really delved into it. So there's different reasons to believe different sources, and if you have multiple credible resources that are pointing in the same direction, that's very comforting. If you've got a lot of conflicting opinions that are, that I think you have to keep going and keep digging and keep evaluating the credibility of these different sources. You can't value that of your gardener's dad the same as you would value an experienced support group leader, for example, who's listened to multiple people. I think it's equally important to really go through this process in detail as it is to get the treatment, because the results of the treatment are something you're going to have to live with the rest of your life.
The number one thing that you can do for yourself in this process is ask a lot of questions and ask a lot of detailed questions. I find that sometimes, patients will be in a support group, or they're talking to a friend, or even talking to a doctor. They're finding out about a treatment, and maybe they don't know the right questions to ask, and so write them down ahead of time. But sometimes when you dig deeper, you find out more information that you didn't know ahead of time, and this is one of the things that I see in prostate cancer often that frustrates a lot of men. they're frustrated that they didn't know beforehand and that they have regrets on maybe a treatment they decided upon or a procedure or something because they didn't realize that this was part of the package. So remember that as you're asking these questions, try to keep a friendly disposition as you dive deeper with these medical teams, support group leaders, patients, because I think even just making sure that you're not coming across as combative, but curious. Concerned and curious is a really great way that you can kind of dive deeper into these situations and find out more information. I know I was talking to a prostate cancer patient not too long ago, and he was kind of being combative with me, which is perfectly fine. He's frustrated. He has a prostate cancer case that is quite detailed, and he's trying to figure it out. But I said to him, you're going to get a lot farther if you keep more of a peaceful disposition when you're talking to your physicians. I think they're shutting down, not talking to you because they're, kind of in this state where they feel defensive. So if you're going to go ask another prostate cancer patient about their cases, if you're going to go talk to these doctors and even maybe disagree with them sometimes and say, well, wait a minute, I heard about this side effect. Why are we not talking about it? I would just really try to keep a peaceful and just kind disposition through that. It's very, very helpful. And we see that patients across the board do much better and find out more information through that process. A couple of other key factors are being willing to travel to a center of excellence. If you can't afford it, or you can find your way there or get some assistance from financial support from your family or an organization, sometimes traveling can really make a big difference. A lot of community centers may not specialize in the best treatment for you, or maybe they do and you're just right down the street and that's great. But for some patients, they do have to travel in order to get what's the best treatment for them so they can also prioritize their quality of life. Now, the third thing, is prioritizing your quality of life. A lot of times as patients go through the process of deciding upon a treatment, we're so focused on surviving the cancer, we're not also thinking about the side effects that can sometimes be lifelong. Sometimes it doesn't just last through the treatment. Sometimes it's years afterwards. And so you want to make sure that you're thinking about your priorities. If your sexual health is really important to you versus your urinary health, it's interesting. Hopefully we don't have to choose, but if you are going to choose a treatment that affects one, the other, or both, it's important to ask a lot of questions about it and know what to expect and then come up with a game plan. For instance, we had Dr. John Mulhall from New York talk about sexual intimacy and health, and we didn't know you were supposed to give penile injections like 6 weeks after a procedure in order to keep and maintain that part of your body. But those are little details that get passed by, and then we see patients go through penile atrophy and no one really talks about it. No one mentions it. And they say, well, you got treated and, you survived prostate cancer. We got it and that's it. You should be happy. Well, wait a minute. For the rest of my life, I'm going to be dealing with these issues. So those are types of situations that we would like to see you avoid. So remember, as you ask your questions, record the conversations, write down what your priorities are. And you can even reach out to our helpline at pcri.org/helpline. These are prostate cancer patients who have been through these situations, but they can help you kind of navigate some of the questions to ask, help you figure out what your priorities are, and also answer questions regarding side effects and what it's like. And as you talk to support groups and support group leaders, it's not only great just to find out about their experiences, but it's also great to kind of hear, how was this doctor with you? What was his demeanor like? Did he have a good bedside manner? Another thing, as Dr. Schultz said, is read the online reviews. And another thing that you can do, there's actually multiple things as you've seen, is that you can look at the academic papers and see if the physician that is treating you or the facility, the Center of Excellence, has published any data in this area. I think it's very important to kind of hold all this in your head as you're walking through this process, because we want to make sure that as you are choosing a Center of Excellence, there could be marketing, there could be clinical trials, there could be a automatic system that they put people through, and we want to make sure that you are being prioritized for what's best for you. Please remember, most of all, you're not alone, and I hope you have a great